Are you already registered?
Welcome, dear viewers. Today is our format Natural Medicine. Today we will focus on the movement apparatus. Again and again there are problems and there are also sustainable solutions. I have two experts for this today. Professor Dr. Thomas Rau and accident surgeon, orthopaedist Janušas Rolandas. Stay tuned. Welcome, you too. Nice to have you here from Sonnenberg, our BioMed Center Sonnenberg. Today we really want to focus on the topic of the movement apparatus. You have really opened up a new field for yourself, haven't you?
Yes. First of all, thank you for allowing us to speak to you. Thank you very much. Because this is a huge topic. The joint tissue diseases, the joint diseases, the diseases of the whole support apparatus. This is a real pandemic. So it's spreading so incredibly. And if you look at it, why does it have such diseases? We'll talk about spinal discs later, about arthrosis and so on. But fibromyalgia is also such a disease, for example, which occurs on the joint tissue, on the musculature. Why has this increased so extremely? So really epidemic, you could say. And you have to look, and we're just much better at that. That sounds arrogant, but it's true. We have very, very good success in our biomedicine center in Schwelbrunn. BioMedicine Center Sonnenberg, that's what it's called. And where we can treat such joint tissue and muscle diseases and joint diseases in a team. Why is that? Because the diet of humans on average has changed the most. You could show numbers. Sugar consumption has almost increased tenfold since 1980. So the intake of sugar is fermented. There is then lactic acid. There is acidity in the body. This is incorporated into the tissue. The tissues become sourer. Interestingly, a term that simply did not exist in conventional medicine. The so-called over-acidification. Not only that, but also the nutrition with protein. The protein intake has tripled since 1950. And man can't process that at all. So we are dealing with a classic metabolic, actually a metabolism problem. And we just say, joint tissue diseases, even back diseases are a metabolic problem. We'll give him the floor later and we'll see. That's fantastic. He tells people as an orthopaedist, I don't know how many thousand operations you've had. He tells people, yes, when they come to me, they have to eat vegan for 2 months first. I know that's crazy. But why? Because then the metabolism becomes deacidified. And then I see people, when they come to me, well, it doesn't hurt anymore, just because they have simply changed for 2 months. The frequency of joint operations has increased massively. The frequency of arthroscopies, well, most of them are not necessary at all. I can see that now, where we have him here. What we see in the arthroscopy, you can see that with a modern ultrasound, or with a modern X-ray. You can also look at it from the outside. These arthroscopies only benefit the orthopedist. But you don't need that at all. If you keep the metabolism with our drugs, the orthomolecular, we give mineral substances, we make the body more basic, we give infusions with a base solution, and so the metabolism is simply changed. And the little nerves that perceive the pain, that absorb the pain in the tissue, are then less stimulated. They just need vitamin B, they need magnesium, they need other trace elements, and they need a base, and then the pain subsides.
Janusz, you as an orthopedist, what is there in folk medicine, or in school medicine, for descriptions of these diseases? Does rheumatism also belong to it, or do you know, what are all those, when the spectator listens, well, movements apparatus diseases?
That's a very broad topic. There is also rheumatism, and the overacidification, as was already said, the overconsumption of protein, and then the body can no longer cope, then it begins to age, faster to age, and this is associated with pain. And if we deacidify, and if we reduce the inflammation in the body, then the pain also slowly disappears, even without major surgery or major interventions.
When was the change for you? You really did thousands of surgeries, and of course you probably learned classical school medicine, and at some point something changed. Now you say you are on nutrition. We know from the school medical training that there is no nutrition.
Of course, there is no nutrition. But the biggest demand was a sailing vacation with different bosses from different companies, and one of them asked me, what do I think about PRP, about thrombocytopenia treatment? That was in 2013. I didn't know anything about it, but he told me so much, that it is done in America. And the dentists have been doing it for a long time, and that interested me so much, that I started reading literature together, and then I tried it on myself, to treat my heel spur. That was the start. And after 8 years with pain, I was free after 8 weeks.
And what exactly did you do there? I only have PRP now.
PRP, these are the thrombocyte treatments. Then you take blood, centrifuge it, then you take the plasma and inject it where it hurts. Okay. Very simple.
One can perhaps explain, for lay people, there are many people who are simply interested that the thrombocytes, the blood cells, they not only have the coagulation and contraction function in humans, but, and this is the important thing, they are also carriers of growth factors, and they transport the growth factors, these are proteins, to the point where, for example, there is a wound.
Das sind Proteine, an die Stelle, wo eben zum Beispiel eine Wunde ist.
And this is how these, for example, you have a cut, and then there is a wound here. How does the human body notice that it has to close this skin here again and not develop more skin here? Because the thrombocytes come there, because they have start the coagulation, so that it doesn't bleed, but they carry the growth factors there. And on this thought this platelet-released plasma is based, the platelet-concentrated plasma, the patient's blood is centrifuged, so that on one level of the centrifuge the platelets are then, the nurse or the doctor takes them out with a syringe, and he does this several times, and gets an insane concentration of these growth factors.
Die nimmt die Krankenschwester oder der Arzt nimmt die mit einer Spritze raus und das kann man dann sogar, er macht das sogar mehrmals und kriegt eine irrsinnige Konzentration dieser Wachstumsfaktoren.
They have an inflammatory reducing effect, a very strong inflammatory reducing effect, and at the same time a renewal effect, and then he injects them there, this goes to the joints, to the ligaments, because people come, oh, everything hurts anyway. But now this tennis elbow, yes, here the tendons in a very small place are extremely many connective tissue fibers, well, then it hurts most concentrated here. And then they go to the so-called specialist, and he says, yes, this has to be operated. This does not have to be operated.
Or cortisone injections.
Und der sagt, ja, das muss man operieren. Das muss man nicht operieren.
Oder Kortisonspritzen.
Or cortisone, this has an... Yes, I did cortisone injections for years. It works fantastically, only you get a permanent customer, because it comes again and again. When you inject cortisone, if you do not at the same time improve the inflammation and the regeneration of the connective tissue fibers, and we do that, and very strictly, but I can still bring the case from the dog owner, yes, with the torn band, but maybe I can do that later.
Ja, mit dem gerissenen Band, aber kann ich dann vielleicht nachher.
How can I imagine such a treatment, especially with heel spur? This is also incredible pain, right?
Before the procedure, yes. During the procedure, I anesthetize, of course. That does not hurt that much. I also do that ultrasound assisted. I see where I am injecting, so that I do not hurt the nerves. And then, after a while, the pain disappears completely, and when working with different concentrations, you do not need to inject 6 times, not 10 times. It is enough for 90% of patients to inject once.
Yes, I find that exciting, that you do not have to do a 10-time cure permanently, but come once, treat, and now we have given the body the signal of healing on time. From your point of view, what is still important, around the body, so that the structure around it is no longer susceptible to such pain concentrators?
Zuzuführen, damit einfach auch die Struktur drumherum nicht mehr anfällig wird für solche schmerzkonzentrierten.
We do it like this. Before the treatment, we prepare the patient. That is, we want to reduce the inflammation in the body.
How?
With nutrition.
What are you doing there?
We take complete sugar out of the diet, then milk products, gluten, and then the body reduces, within 3 to 4 weeks, the inflammation in the body. For some patients, it went so well that they do not need any procedure at all, and those who need it, they also heal much, much faster. Okay, as Thomas has already said,
We have a waiting period, and we tell people, start with a mineral therapy and start with this diet, sugar-free, as low protein as possible, so vegetarian or vegan. The most important thing is cow milk-free and gluten-free. These are the 3 components that promote inflammation.
Und glutenfrei. Das sind die 3 entzündungsfördernden Komponenten.
And then you get an appointment in 2 weeks. Then people always say, it is only better because of that. It is really frappant if you do that.
Wenn Sie das mal machen.
Yes, that's actually the preparation.
Das ist eigentlich die Vorbereitung.
Well, we still strengthen it by giving base agents, base powder, and mineral preparations, which also have a basic effect and improve cell metabolism, these things.
Und halt den Zellstoffwechsel verbessern, so diese Sachen.
Especially when you now address the topic of bases, there are many possibilities and theories. Some say foot baths, full baths, then swallowing powder, then some say again, no, that doesn't work, that destroys the acid pH value in the stomach again, then you are totally confused again.
Exactly. Unfortunately, with research, that would be the assignment of medical professors and universities, that they would finally research these things, and because this is not the case, it is simply claimed, and in this healing scene there are many opinions, but that you should deacidify the body or have to, everyone agrees, but how?
Dass man aber den Körper entsäuern sollte oder muss, da sind sich alle einig, nur wie halt.
We do that with
Wir machen
infusions
das
when
mit
the
Infusionen,
patients are
wenn
with
die
us,
Patienten
and
bei
in
uns sind.
advance and
Und
afterwards with a real
voraus und nachher
nutritional
mit einer
change, a
wirklichen
baseloading.
Ernährungsumstellung,
That is
einer
actually
baselastigen, das ist eigentlich
vegetable-rich,
gemüsereichen,
milk-free,
milchfreien,
gluten-free,
glutenfreien,
sugar-free
zuckerfreien
diet.
Ernährung.
That changes the
Da
body within a
stellt der
few,
Körper
usually
innerhalb
within 2 weeks the
einiger,
people
meistens
notice. But
ja,
after
schon in
6
2
weeks
Wochen
the
merken es die
body is
Menschen, aber
really
nach 6
changed.
Wochen ist der Körper wirklich umgestellt. Ja.
Yes.
The treatment. Yes, sorry.
And when we give the preparations, our preparations for Schwellbrunn, then we also check the patient's pH value, and then we see how it goes up.
Man kann
In
das
the
ganz
urine?
einfach machen.
Yes,
Mit
in the urine.
Lackmuspapierchen kriegen Sie in jeder
You can make
Drogerie
it
oder
very easy.
Apotheke,
With lackmus
kann man den
papers you
Urin
can get them
messen
in every
und kann
drugstore
schauen,
or
wie der
pharmacy.
pH
You can
ist.
measure the
Und so kann
urine
der
and can
Patient
see
sich
how the
selber
pH is,
testen.
and so the
Wir
patient can
geben
test
halt eben noch
himself.
unsere
And we just add our
Basemittel
base
dazu.
agents. Foot
Fußbäder
baths
sind
are
schon
already
gut,
good,
keine
no
Frage, oder
question. Or
Überwärmungsbäder,
overheating
ist alles sehr
baths.
gut.
Everything
Aber
is
das
very
Wichtige
good,
ist die
but the
Ernährung und
important
die
thing is the nutrition and the base.
Basenpulver wenigstens die
Powder,
ersten paar
at least
Wochen.
the first few
Man sieht
weeks.
ja auch am Gewebe, oder?
You can also see
Klar,
it on the
ich
tissue,
meine, man sagt ja immer,
right?
Frauen hätten
Yes.
Zellulite, aber ich
I
glaube, Männer
mean,
holen
they
mittlerweile
always
auch
say
auf,
women have
kriegen das ja
cellulite,
auch. Also da
but
sieht
I
man ja
think
auch
men are also
in der
getting it
Zelle,
now. They
wie die
also
sich dann
get it.
verändert.
So you can
Also,
also see
oder
in the
was
cell
nimmst
how
du
it
wahr
changes. Or what do you perceive
mit
with
der
the regeneration?
Regeneration?
That everything gets better, that the complaints disappear, the people get happier. Yes, that's true.
Ja, das stimmt.
Okay,
Ja.
with the special treatment you
Okay.
do with the blood
Bei
plasma,
der
where can I
besonderen
use it
Behandlung, die du da
everywhere?
machst mit
In
dem
which orthopedic
Blutplasma.
complaints?
Wo kann ich die überall einsetzen? In welchen orthopädischen Beschwerdefeldern?
Everywhere, every tendon, every muscle, every joint, and it repairs. And I would like to add what Thomas said. With growth factors, the growth factors have such a possibility. They call the stem cells that are in the environment to the construction site, and then it regenerates much, much faster.
Die Stammzellen, die in Umgebung sind, zu der Baustelle. Und dann regeneriert das viel, viel schneller.
Then I basically solve my own stem cell therapy.
Ja,
Yes, exactly. Just like with the wound healing, normal wound healing, we reinforce that by transporting from one site to the construction site.
Baustelle.
es gibt
I
ja,
was
ich weiß
just in
gar nicht,
America for
2
2 weeks in a
Wochen
consultancy,
der
and their stem cell
Beratungstätigkeit
therapies are done,
und da
incredibly
werden
expensive.
Stammzelltherapien gemacht.
But you don't
Irrsinnig
need that
teuer.
at all, to be
Aber das
honest.
braucht es gar nicht,
What he
ehrlich
just
gesagt.
said, with
Was
our
er gerade
therapy we
gesagt
can
hat,
stimulate
mit
the
unserer
body's own
Therapie
stem cells,
können wir
maybe a
die
little slower, but
körpereigenen
more sustainably.
Stammzellen halt
We
vielleicht
can
ein bisschen
stimulate
langsamer,
that,
aber
and it can
dafür
even be measured.
nachhaltiger können wir stimulieren. Und das lässt sich sogar messen.
I
Ich
already
hatte schon,
had, before the
der
colleague,
Kollege,
Janušas was
bei
with
uns
us.
war, habe ich
I
schon
already
diese
had these
Plättchen
platelets,
PRGF,
PRGF,
ist es
that's
auch
what it's
genannt.
called. Yes, that's
Ja,
another
das ist
term. We've
ein
been
anderer
doing it for
Begriff.
years,
Haben
and I
wir
had
schon
patients
seit
with,
Jahren
for
gemacht.
example,
Und ich
knee
hatte
arthrosis
Patienten
after an
mit
accident,
zum Beispiel
or we also had older
Kniearthrose nach
people who
Unfall.
simply had knee
Hatten wir
arthrosis or hip
aber auch ältere
arthrosis,
Menschen,
or I
die
don't know
einfach
what kind of
Kniearthrosen
arthrosis.
hatten oder Hüftarthrosen oder weiß ich was für Arthrosen.
And we told them
Und
they have to
denen
operate on
gesagt,
their
ja, dann
knee.
müssen sie das Knie operieren,
A
ein
new
neues
knee,
Knie.
this
Dieses
mechanistic thinking.
mechanistische
I'm
Denken,
getting
also ich werde
aggressive
schon
when I hear that.
aggressiv, wenn ich das nur schon höre.
That's not
ist nicht
necessary,
nötig,
because you can
weil
also
man
inject these
kann
platelets into the
mit
knee,
diesen
for
Plättchen
example.
auch ins Knie zum Beispiel
That's what he's doing
hineinspritzen.
with
Das
us
macht er
now,
jetzt bei
because he
uns,
can
weil er
do
das
it even
noch
better.
besser kann.
And then it
Hineinspritzen
forms,
und dann
we
bildet
learned that in the
sich,
study.
das haben wir im Studium gelernt, das
That's
sei
not
nicht
possible,
möglich.
cartilage
Genau.
don't form back.
Sich
That's a
zurück.
complete
Das ist ein
nonsense.
völliger
That's simply
Blödsinn,
not
das
true.
stimmt
Aber es
einfach
glauben
nicht.
But we all believe
Im
that,
Studium
when you
auch
come out
schon
of the
alle
study,
Orthopäden,
all orthopedists,
Knorpel-
cartilage can't form back.
regeneriert sich
The cartilage
und die
regenerates
Schmerzen
and the
gehen
pain
zurück.
goes back.
Ich habe hier
I've had a lot of
wirklich
people
Menschen
here.
schon
I could
schon
show you a
viele
lot of
gehabt. Ich
cases.
könnte ganz viele Fälle zeigen. Also
Hearty
kernige
people,
Typen,
they
nicht
don't
so,
think much
die
of
halten nicht so
nutrition,
viel
and
von
they have
Ernährung und so.
arthrosis, and
Und
now
die
they
haben
say they
Arthrose und
don't want to
ja,
operate
ich
right
will jetzt
away.
noch nicht
But
gleich
after 5
operieren.
years, they
Ja,
say
aber
they
nach
don't
5
even
Jahren
have to
sagen sie, ich
operate
muss gar
anymore.
nicht mehr
They can
operieren. Ich
walk
kann
down
jetzt
the
wieder
river
vom
for an hour.
See halb
It
See
doesn't hurt
runterlaufen, eine
anymore.
Stunde den Berg runter und es tut mir nicht mehr weh.
So we just have cases like that. Maybe it takes 3 or 4 times this platelet therapy and the nutrition and the basic food. Then it works, and the cartilage begins to regenerate, as well as, and now comes a completely different topic. We had a case, a blatant case. He had a wave accident, and it was with a rabbit had just torn off his skin.
Einen krassen Fall. Der hatte einen Velounfall und dem hat's wie bei einem Kaninchen einfach die Haut abgerissen.
The muscle was open and the skin up there.
Ja,
In the hospital, you have to do a skin transplant. From where? From here or from here? Down there. And he said, I don't want to do that. I'm going to the doctor, to the Sonnenberg Clinic in Schwelbrunn, and then we have to see. And then he came with this naked leg, more or less, and then he practically injected these platelets twice a week or 3 times a week. Plus ozone therapy, and now, after a few months, he can walk again for 3 hours. He is 60 years old.
And the skin has regenerated itself.
ohne transplantieren.
You think, actually, nothing is coming anymore.
That is exactly the most important thing, dear viewers, the most important thing. The body can regenerate itself if you switch your metabolism to regeneration. That is the important thing. It works. So if you have a cut here, it also grows back. Yes, why? Because there is still a bit of regeneration ability. And exactly the same applies. Yes, you mean bones or cartilage would not renew itself. They would be broken at the age of 20. Everything in humans is constantly renewing itself. You just have to stimulate it. And this PRP therapy, especially when you activate the growth factors by basicity, by deacidifying the body, then it works if you bring it to the right place.
What function does ozone therapy have now exactly? What are you doing there? How does it work?
With this patient, we have the gasted. That means we have a whole leg in a plastic bag and then we put ozone in the plastic bag for half an hour. And that worked very well.
What effect does ozone have in your opinion? Why is that so important? We only hear it as bad.
No, that's for regeneration. First of all, the tissue gets a lot of oxygen. And the oxygen is needed for regeneration.
Does it also have a disinfecting effect?
Also,
I could also imagine with such an open leg that the risk of infection is more likely to get a hospital germ.
We actually made a gas chamber. It's like the kids. We have a plastic bag and then we taped it and then ozone gas in and out again. And no bacterial superinfections take place. That's the best antibacterial agent. We don't need antibiotics in such procedures at all. Even with major wounds. We never need that. It's just not necessary. Ozone activates the cell healing, the cell regeneration, but not with cancer. That's also a complete nonsense that you give ozone to cancer, because the cancer cells don't react to ozone and the healthy cells do. But that's just in the meantime. With regeneration, where we want to help out, we can additionally either intravenously, there are large studies, intravenously or locally. I often even give direct injection into this area with ozone gas.
that stimulates the immune system.
That stimulates incredibly.
And works very well. I also use ozone therapy with arthrosis, for example. I also combine it with a PRP. That can also treat the discs. Just like it, with ozone.
Can I also with discs? Basically, the disc is dried up, right? And pressed. Can something like that also regenerate and build up?
First of all, in the case of a fresh herniated disc, the disc tissue is a soft tissue that presses on the nerves. When I inject ozone there, ozone pulls water out of the disc. That means it gets much smaller and no longer presses on the nerve. Plus, ozone revives the nerve. So it gives a lot of strength for regeneration. And then, when I inject growth factors from platelets, the nerves also recover and the discs.
Do you also have experience with this? There was also a documentation, the money machinery with the hip surgery. It was also shown that the hip joints are exchanged like at the assembly line. Can I also work with that?
Yes, with PRP. To a certain extent. With hip joints, we have very good results, but not as good as with knee joints, for example. My oldest patient was 96, from Finland. I treated arthrosis with PRP. Next year, he ran a marathon. The fact that you don't have a cartilage doesn't mean that you can't run. The pain is not due to cartilage, but the environment.
There is a rule. You asked about the hip joints. That's a great case. The bigger the joint, the worse the therapy works. The knee is an extremely complicated joint. The therapy works very well there. For example, the thumb joint. Many women have these problems. Or the wrist. The PRP works much better than the operation. The smaller the joint, the more difficult the operation. On the other hand, the better the results.
Also then for carpal tunnel syndrome.
Yes, it's different. The band narrows. I'm almost 100% successful. Carpal tunnel syndrome can come back. But also after the surgery.
I do hydrodissection. I inject growth factors into the canal. Normally that's good. But with carpal tunnel syndrome you should check the spine.
We could look at that in the next interview.
In many cases it is confused. Why do the fingers hurt? Mostly not because of carpal tunnel syndrome, but because of the discs.
That would be exciting if you could come back. Then we'll get to the topic.
When he came to us, I asked him why he had this insane orthopedic position. 2,000 operations. Why do you leave such a great position? Yes, he is honest. 90% of orthopedic operations are not necessary. It's good for the orthopedist or the clinic, but it's not necessary. I can do exactly that, especially with the complicated joints. The knees, the shoulders, the wrists, the ankle joints. I can only confirm.
Great. Thank you for being here. We'll get back to the topic. See you soon. Dear viewers, exciting topic. What you can do to regain a healthy musculoskeletal system. I hope you were able to take something away with you, and I thank you for watching. See you soon.